Everyone, it's Daniel here from Aspire, and today I'm here with one of our physios, Handy. How are you?
Good.
Awesome. What are we talking about today?
Today we're going to talk about low back pain, and I've got a question for you, Dan.
All right.
Have you ever experienced any back pain in your life?
Not like hard, severe back pain, but sometimes when I've been walking a lot, I do feel it. And I have a few little strategies that I do that just give me instant relief. So I might dive into those a little bit later on in the video. Yeah, what about you?
Yeah, I've got a little story. I was at home in the piano room for my mom, and I needed to pick something up, and I got a real painful shooting pain in my back. It was like that I was really stuck. I couldn't move. I was stuck there like for a minute.
Yeah.
Yeah, it's called lumbago. Maybe one of the viewers of you have had it once before.
Right. Okay. I mean, we hear it all the time, right? You might be exercising and more active than most, but at some point it's going to get you, right? Whether it's from a sudden movement or playing sport or an accident or impact or weakness, there's obviously that overload that leads to pain or lower back pain at some point in time. So what are the two types of back pain? Like, how do we categorize it?
Yeah, so we've got two categories. The first one is specific low back pain, and there's a specific anatomical structure that is damaged. So we've got herniated discs, fractures, and tumors. And the second category is the non-specific low back pain, where healthcare providers tend to treat muscles, joints, and ligaments. And yeah, every healthcare provider has its own approach and vision of how they treat it and what to treat it. So there's a bit of a discrepancy in it.
Yeah, I guess it all comes down to personal experience and being able to, like, the more clinical hours that you have working with different types of cases and patients and clients over the years, we can assess all those possible options and then kind of narrow it down to maybe the one or two approaches that we think are going to have the best response for the client. So what are the two modalities that you use most successfully when you're treating your clients and patients?
So for me personally, as a physio, I would use manual techniques and exercise therapy. So these two are my two favorite modalities. So first, to loosen up muscles if muscles are tight, or to relieve joints if the joint is tight. And then to make the muscles around the joints stronger, we provide exercises.
Yeah, I think we've, over the years, we've found especially those two approaches, especially on identifying the root cause, which is usually weakness. And so muscles are then overactive, and that's what triggers a pain response, right? Because pain is simply a feedback mechanism to say, hey, there's something not right here, and I'm doing a lot of extra work here, and I need some help. So we find that reciprocal inhibition and being able to activate the nervous system to strengthen and stabilize especially glutes and the core have a tremendous impact on just giving immediate relief. I think probably one of the challenges is, though, that many people will do the exercise until they're pain-free, but they don't continue to prevent it from happening again in the future.
Yeah.
Yeah. So what can you recommend for people that have back pain, like recurring back pain, or what they need to do differently to prevent it from coming back in the first place?
So what I think is most important is the lifestyle and being aware of what you do in daily life. If you start over there, then a lot can change in order to prevent recurrent back pain.
Yeah, I think it comes back to awareness, right? Whether it's hunger, nutrition, pain, sleep, energy, the results that you're getting in life, it all comes back to awareness and being able to seek the expertise to help become your best future self. So, thanks, Handy. That was handy.
Thank you too, Dan.
Good. All right, guys, we'll see you in the next video.